I'm Dr.K.Gireesh, a neurophysician and neurosurgeon. On behalf of Lions Club of Madras Excellence, we are conducting a public awareness health program. Based on this, today I'm speaking to you on the do's and don'ts of epilepsy. When you have an abnormal discharge in the brain, an electrical discharge, you get a seizure. When you get these seizures repeatedly, you call this epilepsy. Now let's see the do's and don'ts of epilepsy. Do take the medication regularly on schedule. That means the prescribed medicine should be taken regularly on every day. You should not even miss one dose. The second is do eat nutritious meals at the appropriate time. That means take your morning breakfast at 7 o'clock in the morning and 10 a.m. Try to take some Horlicks or soft drinks or some soft juice. And at 1 o'clock, you should have your lunch. Evening 4, tea with snacks. And at 8 o'clock, your supper or tiffin or whatever you'd like to take, you can take. And before going to bed around 10:30, 11, a glass of milk. If you skip a meal or if you postpone eating, the blood sugar will come down and you are prone to get an attack. So do eat nutritious meals at appropriate time. The third is do sleep adequately. That means you have to sleep around 6 to 8 hours every day. This is very, very essential for the harmony of your brain. The fourth one is do visit your physicians once in 2 months. It so happens that whatever be the advice what we give you, it lasts in the brain only around 4 to 6 weeks. After that, it slowly wanes off. But it will be there. Maybe in some time, when you see me somewhere, you remember immediately. Or see your doctor somewhere, you remember immediately. The advice is given. That is the beauty of the brain. Do follow the instructions of the physician accordingly. That's the fifth point. Please see that the advice of the physician is being carried out very regularly. Do tell the teacher or the colleague in your workplace that you have a problem like this. If you're studying in a school or college, it is better that your teacher knows about this, so that if any problem occurs, they will know what first aid in fact to be given. And 1 or 2 colleagues of yours, you should make them aware that you have a problem like this. Do continue your regular activity. That is in fact the 7th one. When you say you are a normal person, provided you take the medication every day, you can go around with your normal activity. Do avoid driving long distance and driving in the night especially. You must avoid that driving in the night, because that keeps you tiresome and can prone to get an attack. When you start your medication, if you are a person who is driving, at least 3 to 4 months, please do not drive. And if you are regular in your medication, your blood level is being maintained, after about 4 or rather 6 months, you can renew your driving. Do call your doctor if you're not feeling all right. At any particular point of time, if you have a fever or some other problem, please do call your doctor, get the advice. But whatever be the medications you're taking, never stop the anticonvulsant drugs. 10th point, do avoid getting advice from unauthorized medical practitioners. Extremely important. And never stop the medication abruptly, because then there is a chance of getting repeated attacks. The 11th point, do carry an identification card with you all the time, especially when venturing out alone. Please do have it in your pocket, like how you have a credit card. You just write down, I am an epileptic and I am on the following medicines. Please see that it is being done. The 12th point, do drive only if your seizures are under very good control. Very, very important. So these are the do's of epilepsy, which I have told you. Now, let me tell you the don'ts for epilepsy. Don't drink alcohol, number 1. Alcohol is a poison. The moment you take alcohol, it goes into your stomach, and from there, you find it slowly reaches your liver, and your liver, which is on your right side, you find below in the subcostal region, is like a machine with 500 metabolic activities that are going on. And you find if you take alcohol, it goes and hinders that, number 1. 2, alcohol can in fact even also react with the drugs which you are taking and reduce the blood level, and thereby you can get an attack. Number 2, don't take street drugs. Avoid developing any sort of cocaine or any other drugs. 3, don't have irregular sleeping habits. Don't disturb the sleep rhythm which has been given or endowed on us by God. Very important. 6 to 8 hours of good sleep is very essential for you. Don't eat poorly. As I told you earlier, eat an adequate quantity of food at the appropriate intervals. Don't swim alone or without supervision. When you go to swim, what happens is you hold your breath. And when you hold your breath when you are swimming, if the breath is not sufficient, you find lack of oxygen to the brain and you can get another attack. So don't swim alone or without supervision. There must be somebody there, in fact, to help you out in case if you have a problem. Don't forget to take your medication. Extremely important. You can use something like a drug dispenser, which will be very useful for you when you have what you need to take the medication. Even if you miss one dose, you will find that you can get an attack. Sometimes if you stop it abruptly, you get repeated attacks. Therefore, you've got to be very, very careful. And you have got to take these medications for a period of 3 to 5 years. This drug dispenser is very, very useful for you. This contains cubicles. So morning and night dose with the cover can be cut and kept it inside. Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. Keep it on your dining table. And you find when it is Sunday, when everything is over, you can again refill it. So when it is on the dining table, you will never forget it at all. Well, I must tell you all, the last 40 years, all those patients of mine who have been using this drug dispenser, they have been taking their medicines very regularly and have a good control of epilepsy. The 7th one is don't go to unprotected heights. Extremely very important. The 8th one, don't worry about seizures, because this can lead to depression. You are as normal as anybody, provided you take your medications very regularly. The 9th one, don't eat unwanted or partially cooked green leafy vegetables, because they can have the eggs of tapeworm on that. Therefore, avoid that. But you can eat vegetables which are well washed and cooked. Well, ladies and gentlemen, these are the do's and don'ts of epilepsy. To summarize, ladies and gentlemen, the do's and don'ts for epilepsy. 1. Do take medications regularly on schedule. 2. Do eat nutritious meals at appropriate time. 3. Do sleep adequately. 4. Do visit your physician once in 2 months. 5th, do follow the instructions of the physician accordingly. 6th, do tell your teacher or your colleagues in your workplace about this problem, whom you are confident in. 7th, do continue regular activities of yours, since as you're a normal person, as long as you take the medication properly. 8. Do avoid driving long distance and driving in the night. 9. Do call your doctor if you're not feeling all right. 10. Do avoid getting advice from unauthorized medical practitioners. 11. Do carry identification with you all the time, especially when venturing out alone. 12. Do drive only if the seizures are under good control. The don'ts for epilepsy. 1. Don't drink alcohol. 2. Don't take street drugs. 3. Don't have irregular sleeping habits. 4. Don't eat poorly. 5. Don't swim alone or without supervision. 6. Don't forget to take your medication. 7. Don't go to unprotected heights. 8. Don't worry about seizures. This can lead to depression. Always think, and you are a normal person. 9. Don't eat unwanted or partially cooked green leafy vegetables. They could have tapeworms. Well, ladies and gentlemen, these are the do's and don'ts